Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Men in Ireland are not willing to go to the doctor for anything, but there's a lot of, I suppose, inhibition from men when it comes to migraine.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. Hi, I'm Joe Coe, Director of Education Digital Strategy at the Global Healthy Living Foundation and a migraine patient for over 20 years. I'm delighted to speak with someone internationally today, Pascal Derrien, who is the Executive Director of Migraine Ireland. He's been doing some really amazing work leading that organization over in Ireland, and I thought it would be a good opportunity to connect with him and hear and learn from him about his perspective. Hi, Pascal. How are you doing today?
Hi, Joe. I'm good. I'm always good. Thanks for having me.
I was so happy that you're on. Let's start by finding out your connection to migraine and chronic disease. What brought you to this work, Pascal?
I came across the Migraine Association of Ireland 25 years ago on a different path in an hotel somewhere, and they were giving a talk. But I was actually pretty surprised that 25 years on, actually, they would come near me, and migraine was slightly more than I was expecting. So I still, like most people, had a preconception or perception of migraine. And when I ended up having some chat with the board during the recruiting process, I realized that actually that was way bigger than I thought, starting with being a neurologic disorder and all these type of things, and not just a headache, which is obviously one of our taglines. Also because the fact that it was a chronic conditions really interested me. While I'm not a migrainer myself, I'm diabetic. And I think there's an overarching principle of chronic conditions along the spectrum. You know, you live with a sort of Damocles above your head. Some are medicalized more heavily than others. The anxiety, the attacks, the up and downs, they're going to the doctors and all that jazz, medications. So I find actually more similarities with my own condition, at least from an understanding perspective, than really a lack of knowledge. So I felt relatively at ease. However, I had to learn quite a lot, no pun intended, but my brain was blown away when I 2-3 months in, I learned so much about it. And also how prevalent was the condition in a society, how highly it was ranked from the WHO perspective and all these things. Yet there's a lot of trivialization and stigma in a society at large, but also in workplace in particular. So that really interested me in terms of, how we can push the narrative in a different way, at least from an Irish perspective.
That's a really good segue to my next question, Pascal. I want to know what the mission of Migraine Ireland is and how it is being an Irish person living with migraine.
So Migraine Ireland, for us, our primary mission is really to educate. And that's really at the core of what we do day in, day out. And we do this through various channels. So we have what we call a patient channel, where we run 20 to 30 events open to the public. We facilitate them. We invite doctors, professors, nurses. We also have another program, which is called Workplace, where we educate people who may not know too much about migraine. HR practitioners, D&I, champions, HR or business unit managers, and so on. We have started to work with some private insurers and well-being companies as well. Our reach is really people, education, and outreach. We also have self-management courses for migraineurs, and we also have an info line where we do signpost people towards either neurologists, or we try to demystify the few urban myths as well. However, we are not clinically qualified, so we're really only a signposting. We never really get involved in terms of, prescription medication and so on. So we leave that to the healthcare professional. We are tiptoeing a bit in research, and by that I mean we are supporting some startups, pre-startups, and also people who are doing PhDs in terms of research from a survey perspective, because we have access to migraineurs. From a migraineurs perspective, we also have a closed digital platform, which is a peer-to-peer social media for migraineurs. It's only for migraineurs. We have healthcare professional and anybody who wants to sell products. So it's just really migraineurs who are sharing tips, experiences. It could be anything to how do you travel overseas when you're a migrainer, to I have that product, I'm trying this, it doesn't work, so what's your experience, and so on. So in a nutshell, that's what we do.
That's really fascinating. Pascal, what is the access environment like around treatments? Here in America, we have access to CGRPs and neurotoxins and neurostimulation devices and all these different things. Is it like that in Ireland? What are some of the unique challenges?
I suppose in absolute terms, yes. In reality, I probably need to provide you a bit of context about Ireland. So Ireland is a small country, 5 million or 5.1, depending who you talk to. 600,000 people suffer from migraine in Ireland. So it's roughly a ratio of 10 to 15%. Ireland as a country, from a structure perspective, is highly fragmented. So you have Dublin and then smaller cities or towns. There's a huge deficit, and it's not only in Ireland, but we know in Ireland, we feel it very acutely. There's a huge deficit of knowledge in a healthcare practitioner population. We don't have many neurologists who are specialized in migraine, who have a huge interest in migraine. The number of GPs is actually not high either, and the training around migraine is actually almost inexistent. And then clinical nurses who would be specialized in neurology, there's a huge deficit of them in Ireland. We probably need around probably 120, and there's a gap of 60. So it may not sound a lot by American standards, but for such a small country, that's actually pretty big. In terms of high technology product, yes. However, at pharma level, from the day of submissions to, let's say, go to market, I think the rest of Europe, you could say roughly on average, it's 200 days, providing the economics are favorable, obviously the clinical trials and so on. In Ireland, you're talking about 600 days. So we are lagging behind big time. So it's not overly structured. If you happen to have private insurance, that's okay. If you don't, it's a different story altogether. Already from the public system, there's always a lot of waiting list on various pathology. So migraine non being lethal or fatal in terms of outcome, I can let you imagine where we are in terms of waiting list. However, there's also some, I suppose, hope where, for example, the HSE, which is the equivalent of the National Hospital System here, Healthcare Service Executive, have also kicked off some pilots around pathway to care for headache. And Migraine Ireland has been playing a pivotal role in terms of steering committee. But the pilots have been very conclusive. Migraine Ireland has been, I suppose, referred as one of the reference organizations for non-medical care. However, it has not properly been launched within the country past the pilot in terms of execution. We are still, I suppose, a couple of years away from having the structure in place. So yes, we have access to most of the medicine available worldwide. However, the execution is a bit more problematic and is a bit more fragmented. Also, we have a huge deficit in terms of technology when it comes to e-health in Ireland. So we still do things on donkeys with papers and stuff like that. So I not necessarily want to add some paddy whackery to the leprechaun image of the island. However, the reality is we are not there yet. So there's some programs and pilots, but they are not really in full execution day in, day out.
Yeah, and I think you guys are doing amazing work to help address some of the stigma, to raise the profile of migraine, to really explain how it is a disease that deserves and warrants the attention from health systems. To that end, I noticed in looking at the work that Migraine Ireland does, you developed a workplace program to educate workplaces about migraine. Can you talk about what you're doing there and why that's important?
Yeah, absolutely. So I took the organization over roughly 14 months, and I think we had a very strong muscle geared up toward patient or general public. If you bark at the same tree, you always get the same results. So we decided that it would actually, in order to have an impact, it would be good if we were to develop a narrative geared up to people who may not know too much about migraine, because that's where stigma happen, especially in the workplace. When you think that 11% of the people who are migraineurs who are working either lose their job, have to go part-time, or have to repurpose their career, it's pretty important. Also, it's one of the few neurologic disorders where people are still in employment, by and large. So we thought it was critically important to educate. So 8 months ago, we decided to have a kind of a programmatic approach, and the programmatic approach would be in threefold. The first point would be to get migraine awareness, kind of a 101 around migraine, what it is and what it is not. And at this stage, it does, it's 90% of our work. We also aspirationally, once we have had the first talk, we can come back with a second talk, which would be a bit more tailored, a bit more scientifically geared up towards a specific population within the employer. And thirdly, we've been working on it for 12, 14 months. We are looking at potentially having an online accreditation, which would sit primarily in corporation for starter and being part of either a well-being program or, I suppose, training participation from employees, and with an accreditation in the end on the certificate. We're not necessarily where we want today because we're working with some organizations who are working on a larger scale, and we're a small country. So whether it's adjustable or not, what we know as well is we are touching corporate at this stage, which is the tip of the iceberg, because 95% of the companies in Ireland are actually very small. So the second stage with us would be to reach out to SMEs where they may not have a DNI or an HR practitioner, and but you still have migraineurs working there. And we don't want people to be stuck in a corner or be victimized and so on. Also, we are pushing the narrative to have migraine included in the DNI narrative, and it's really important around whole chronic conditions, non-visible disabilities, and so on. I think DNI has had a lot of inroads the last 10 years, LGBTQ+, gender, ethnicity, all this type of thing, absolutely needed to happen. Now it's time to pass to a second phase. Really, there's a lot of diversity in the workforce, which is not necessarily linked to what I was outlining earlier. So well-being is an important one. Also, while migraine tends to impact ladies in their prime, it's not only ladies, it's also gentlemen. And some people carry the flame of migraine way past their 50s or their 55 as well, and it needs to be addressed. Now people are working longer. So in companies, it's also important. So what do you do with people who have chronic conditions? And not only migraine, it could be diabetes, it could be anything else. So what do you do with those people? Are you writing them off or you accommodate them? So we have the Reasonable Accommodation Act in Ireland, which is geared up towards disability. We are really doing a lot of lobbying just to try to get migraine included that, but not only migraine, it could be epilepsy and so on and so on. So the workplace environment is a huge and untapped opportunity for us. And so far, the response is actually pretty good. Also, when you add that the economics are pretty telling, 260 million euros impact on the Irish economy. For such a small country, that's pretty staggering. And lastly, million of days of work loss. Then you start to get traction from the CFOs. There's always a ha-ha moment. Oh, that's not just a headache.
Yeah, show them the numbers. What I really appreciated about the Migraine Ireland site was that you had a section for men. I often don't see that as a man with migraine. I thought that was really cool.
Yeah, and actually, I just want to build on that. It's an interesting one. Obviously, it's a 70-30% ratio, so 30%. There's a lot of men who are undiagnosed, and men in Ireland are not willing to go to the doctor for anything. It's not only Ireland, but it's always very hard to get traction on that front. We have done a couple of things. We're not there yet by any stretch of the imagination. We have on a monthly basis something called afternoon tea, where people just drop by, exchange, and very recently we're starting to see it was only ladies for whatever reason, unless I was there. And the last few months we're starting to get gentlemen showing up, and that's interesting. Not necessarily a huge number, but though they're there. We also organized a talk, a public talk geared up only to men. What was interesting, a lot of people did sign up, but not a lot of people did show up. So we're going to continue on doing it because it's a super important job. But there's a lot of, I suppose, inhibition from men when it comes to migraine. It's seen as a weak condition and so on. So we probably need more people like you, Joe, to do what you do and talk about it and say it's perfectly okay to talk about it, because it's actually, it goes in tandem with the trivialization. It's just, it's a lady's condition. Just go to the pharmacy and get her some paracetamol, and it's just a bad hangover, all these type of things. There's a huge misunderstanding. So while women are a bit more forthcoming when it comes to describe the symptoms and go to healthcare practitioner, we know that's not the case in Ireland. So I'm glad you have noticed. In terms of impact, it's one of our priority to, I suppose, magnify the impact or scale up our impact in that domain there, and also for children. It's a journey, the famous journey, as people would say. But we're working on it. And anecdotally, we have some good response.
Yeah, it's definitely true. I remember I was switching treatments and adjusting to a new one, and I was working with a personal trainer and weightlifting and doing all these very, what people would consider masculine, bro-y things here in the States, and loving it. I lift weights a lot now, and I think it's great, and it helps me manage. Also can trigger some folks, works for me. And I noticed that on your website too, that you talk a lot about exercise and how to work with people to find what's right for you. But I think the process of sharing that I have migraine, I'm getting dizzy, we have to scale back on some of these activities before we ramp it up in the future for me to get my disease under control. I think as men, many of us wouldn't feel comfortable having that discussion because you want to continue to push. And like you said, Pascal, we don't want to be seen as being weak. But I think that the more that we're real about our pain and that this is a real disease, people will be impressed with how strong we are, because we're dealing with this disease that can be very debilitating, and we're figuring out ways to manage it and do it in ways that are healthy, that listen to our bodies. And so I love that you're doing this work with Migraine Ireland.
Thank you.
My last question, or one of my last questions for you, I noticed you guys just did a big cycle fundraiser.
Yeah, so it was an interesting one. So I'm a cyclist. I do endurance sport. I do marathons and stuff like that. We know that sports, or especially endurance sports, is obviously a double-edged sword for migraineurs. And we were debating as a team, is it the right thing to do? Are we going to exclude some people, and so on and so on? So we spoke to a few, kind of a focus group almost to a certain degree. We spoke to a few migraineurs, and we came up with the idea that, first we need to spread the message further afield, maybe towards a community who may not know too much about migraine. So again, an opportunity to spread the message into different channels. The second bit was a fundraiser, because like a non-for-profit organization, we are tight, budgets are tight. We love to do more, but we don't necessarily as much as we would like to. And thirdly, we realized that the format would try to be inclusive insofar that we would propose a 50 kilometers at moderate pace and 100 kilometers with more experience. We found out that actually there was far more migraineurs that were willing to take on the challenge, albeit some would tell us, I will be only able to confirm I'm showing up probably on a morning on the day before, depending on how my chronic migraine does evolve that week. And that was okay by us. But we had a cyclist which is very well known in Ireland. It was very well known probably more 20, 30 years ago, Sean Kelly. And it came to us. So that brought quite a lot of attention. We had quite a few press releases, some interviews on the radio and stuff like that, tagging along with the cycle. On the day, we had some migraineurs, actually some Irish migraineurs, who actually flew over from France, where they're based, and brought some other migraineurs with them, but took on the challenge. And I think it was brilliant, because there was a big smile at the end of the challenge for those who took the 50K. And I think there's a couple of migraineurs who took on the 100K, and just a sense of accomplishment and being a part of it. Because very often in those events, people either dropped their, looked over, all these type of things. On a day, each group was staying together. So you may not know more about cycling, but sportive, some people tend to take off and they disappear, and it's like, it's not a race, but people think it's a race. Purposely, the two groups, we had to stay together. And actually, we merged at the end, the last 10K together. We worked out something that everybody finished together. And it was a great day. We're planning the second one already. We're also planning some other events, maybe a jog walk, a 5K, where actually it's far more, I suppose, feasible for migraineurs to walk and whether they walk 2K, 3Ks, or 5Ks, we'll see. So we really want to make sure that people understand that while it's a chronic condition, you can still do things. You may need to adjust. You may not be Usain Bolt. Having said that, you could. And I think it's really, for me, try to empower migraineurs as well, because sometimes people who suffer from chronic condition, there's a lack of self-belief. You almost writing yourself off. No, I think you need to adjust. I think you need to embrace to a certain degree, but I think you need to be accountable as well. I think you can go towards the healthcare professionals, but I think you need to do some work. Obviously, the diary and the patterns and the triggers for a migrainer are the key to the diagnosis. But for any other chronic conditions as well, I think you need to embrace and accept. There's an acceptance somewhere that you actually are experiencing a chronic condition. And I think it makes things easier. But when it goes back to exercise and sport, I think if you adjust, I think that's important. You were mentioning weight and so on. And there's some weeks you may do more, some weeks you may do less. And that's okay. And the important is consistency. And routine is important in any way, or whether it's migraine or any other type of chronic condition, exercise is key. I think sometimes the gray area for migraineurs is, it's a double-edged sword, and you're not too sure whether it's going to trigger it or whether it's actually going to help you prevent it. I guess it's trial and error. You get to know yourself. But no, it was great, and we'll do it. And the interesting bit is we had a few people coming to us, just, having a 5-minute conversation. I say, you know what? I know more about migraine. So next time I hear migraine, I'm not going to laugh, and I'm not going to dismiss it. I think it's far more important than how we were speculating about. So, if we can change the mind of individual one at a time, that's pretty much what we're trying to do. And the cycle was one channel for us.
I loved in your materials promoting the cycling event that I think you ended it with, "We do it for those who can't."
Absolutely.
And I think that is a really important message. That's many of us as advocates feel, we do that because we can. I appreciate all the work that you're doing, Pascal, that Migraine Ireland is doing, that we're going to be able to do together as a global migraine community to ensure that everyone gets the support, care, and love that they deserve when they live with a disease. So thank you. Thank you so much for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.